So in this video, we're going to cover the second set of clinical medical style statistics. And so let's say we ran a study. So everything we did in the last block really covered about the test that we were using to determine whether or not someone had a disease or, whatever. And let's say this time we ran a study and we had two groups of people. Traditionally, group 1 is our experimental group and group 2 is our control group. But both groups might get some sort of intervention. It's just that you're comparing like a desired group 1, and usually the desired group, the thing that you're testing that you think is better. And then we would look at the people at the end of the study who still have the disease versus now do not have the disease. So this is people that you've pulled because they have this specific disorder disease, like diabetes is a good example. And then you gave them some sort of intervention, two different types of interventions, or maybe you didn't do anything for group 2. And you're looking at people who are still having that problem versus not having that problem. So for my athletic training group, it might be people who still have the injury versus now they don't have the injury. And what that does is it creates a sort of still stuck category and a much better category. And then we have our totals for each group and the total people still with the disease and not with the disease. Okay. So what we can calculate from those, from our study is first is event rates. So event rates is the rate of the outcome present or the disease or the injury to the total for that group. So we can actually calculate this for both groups. It's going to be important. Okay, kitty, run away. We're calculating essentially the rate of them still having the disease to the total. So hopefully this number is small. But we're going to use those rates for some of our other statistics, specifically relative risk. So relative risk is a ratio of the risk in an experimental group compared to the risk in the control group. So when you're working online with the tool to calculate these things, the control group needs to be group 2. So we've got this new fancy thing that we're trying to promote and say that this works much better compared to control, doing nothing, or some previous type of intervention. What that does is it compares the rate to group 1 to the rate to group 2. And I say you want this number to be small because relative risk, think about this, risk, we want risk numbers to be low. If we have a really high number, that means whoever's in group 1 has a much higher risk of keeping the disease than group 2. So you want these numbers to be kind of small. Unlike the likelihood ratios we talked about before, about the predictiveness of a test, now my risk values to be low. Because it's a ratio of the risk for me in group 1, the rate of the disease in group 1 for the rate of the disease in group 2. Okay. Separate from that, so the relative risk is about the rates. Remember, rates is disease to total here. Is odds. So odds for each group versus rates. The odds is the ratio of the presence of the disease to the absence of the disease. So we probably still want this number to be low. Whereas rate is the disease to the total. This is disease to non-disease. So the odds of being in the disease group, which we'd hopefully want to be small, right? So we want the odds of still having the disease after our intervention to be low. Just like we want the risk to be low. Okay. Now odds ratios, so odds is just like within each little group. Odds ratios is the ratio of the odds to experimental group to the control group. So just like we have a rate, so rate is for each group separately, and then relative risk is a ratio of the rates. We have odds for each group separately, so there's a lot of ratio words in here. Right? So the odds of disease for each group separately. The odds ratio that you traditionally see reported as OR is the odds for group 1 to the odds for group 2. Okay. And so that's the likelihood of having the disease to the non-disease for group 1 to the likelihood of having the disease to the non-disease for group 2. Okay. And when you frame it that way, the likelihood of the disease to the non-disease group, that's a bad thing. So we want our odds here to be small. you can flip this on its head and say, I'm really interested in, like, let's talk about AT for a second, these training programs where they're less likely to get injured. And so I want to look at the likelihood of non-injury, right? So I can take these odds and flip them the other way. So when you're reading research articles, be sure you understand the direction that they're talking about. Okay, I'm presenting the most common direction, where it's the odds of the disease to the non-disease, but they could most certainly take that and flip it on its head. Okay? Where I am looking at the positive outcomes instead of here, tends to look at the negative outcomes where we still have the disease, or we're still risk in this case being the risk of still having the disease. Okay? Oftentimes, instead of odds, I feel like odds ratios are more common from the literature I've seen across the years, helping people with their meta-analysis project. But you can also get log odds. Log odds is just taking the odds ratio and taking the natural log of it. Some people feel like it's a better representation when you're comparing different odds ratios to each other because of issues with prevalence. So you'll sometimes see log odds. The only thing you need to know about that is that it's an odds ratio when you took the natural log of it. So we can calculate these values, and again we have to be careful about the order of the boxes. Alright, so let me hit escape here. We're going to go back to VassarStats, click on clinical research calculators, or you can use that link to go there directly, and it's actually calculator number 3 this time. And so it explains a lot of that stuff up here, but so we've got our condition here, absent and then present. So depending on the way that you want to order your boxes, I did present and then absent, but let's say we have a study and we're trying to reduce the rate of negative outcomes after surgery. So I've been working with this group at Temple who does studies on urology, and so they're looking at negative outcomes after certain types of surgeries that I can't pronounce. Things like sepsis, septic shock, and urinary tract infection, so bad outcomes. And so they have different things that they do afterwards. So let's say we have a study here where we have group 1 as our experimental condition where we're giving them different types of treatment care after surgery. And we want to know how many of them have problems after surgery. Okay. So people who have no problems, let's say we have 10 people who have no problems after the surgery, but we still have 2 people who do still have problems after the surgery. And in group 2, we didn't do anything for, and so let's say we still have 12 people, and so we got 6 and 6 here, where they were sort of equally likely to have problems after the surgery. Okay. So we hit calculate. So the numbers that get calculated here are the rate, and it tells you down here what these are, so if you're having trouble remembering. So the rate is the proportion in each group of the condition present. So here this is 2 over 12. Right. Let me make sure mathematically that's correct. 2 divided by 12, 0.16, great. And then here it's 6 over 12, so 50-50 rate here. The risk ratio, right, is rate 1 divided by rate 2. So I have a pretty low risk being in group 1 of staying in the present condition here, having problems after surgery. If my risk ratio is over 1, that means it is more risky to be in the experimental condition than the control condition. So we always want these numbers to be low. The odds ratio here is present to absent, so 2 to 10 here. The odds ratio for group 2 is 1 to 1, okay, 6 to 6. And so you're equally likely here to be in either present or absent in our control condition. In our experimental condition, you have 0.2 odds of still having complications after surgery. Okay. So those are the odds for each group, and I didn't mean to make this happen, but the odds ratio of the presence of the disease for group 1 to group 2 is 0.2. Okay, so that's 0.2 divided by 1. So I really like the way they lay this out. It's rate for each group. This one divided by this one is this one. This one divided by this one is this one. Okay. Log odds here is just the log odds of this number. I personally like odds ratios because the interpretation of them is much easier. So it's the ratio of being present to absent divided by the ratio of presence to absence. When you get a log odds of a negative number, that just means that it favors the first group. When I teach logistic regression, I find that very confusing. OR to me is much more interpretable. So if you have a small number, that means that it's more favorable to group 1. If you have a large number, it's more favorable to group 2. All right, so then it gives you the confidence intervals for those as well. It actually gives you a chi-square test, as long as you have large enough sample size, which I don't, which is what it's unhappy about. But it also will give me Fisher's exact probability test, which if you did the chi-square test, you would know that this is a test to see if the pattern of results is the same across those 4 conditions, and it's really good for small sample sizes. But here we're more interested in the risk, odds ratios, and log odds. All right, so another piece that goes along with this is the absolute benefit increase, or sometimes called the absolute risk reduction. I think it's actually more likely to be called absolute risk reduction now that I've done a little research on it. And what it is the difference in rates between the experimental group and the control group. So it's how much that rate of the disease is going down between the two. So this is a bad case where the rate for group 1 is still higher than the rate for group 2. So this is the absolute risk reduction of 16%, and it's actually in the wrong direction because we want the rate for group 1, our experimental group, to be lower than group 2. So that was just an example. I had typed in some numbers. Let's go here. And if you're confused about any of this stuff, like Wikipedia's page on absolute risk reduction is actually really great, and they give you a bunch of examples. But on VassarStats, we can go back and we can look at our rates here. So 0.16 to 0.5. So we've reduced down to 16%. But for some reason, that subtraction is always experimental group first. So we've gone down 33%. And I think that's because if it's a negative sign, that implies that the risk reduction is negative, where if it's positive, that's a risk increase. Okay. All right. So what we can do with that is calculate numbers needed to treat. So numbers needed to treat is the number of people who need to be treated to prevent one bad outcome, or kind of conversely produce one good outcome. So it's the number of patients that you would have to treat with our new experimental treatment compared to the controlled treatment to get one more favorable outcome. So in this case, it would be 1 divided by 0.33, if I can hit the right buttons on my calculator. And so we would need to treat at least 3 people. Okay. In the case from the other example, I would need to treat six people. But remember, this is not a good thing because the rate actually is increasing for group 1 than group 2. So all that together that we can calculate the different things. So this is all about the study, whereas clinical block 1 is really more about the test itself. So we can calculate rates, relative risk, odds ratios, absolute risk reduction, which leads us to numbers needed to treat.